Good morning, everyone. Thank you for following us today in person in this beautiful session venue of the Inter-American Conference on Social Security. And thank you for joining us remotely via Zoom or via digital content means. We welcome you all to this 49th session of the permanent seminar regarding the well-being of America. We're honored to introduce the sixth document that's been like part of what we've written in the Institute about the elderly population of the different Social Security bodies. I'm Vanessa Stolinovsky. I'm going to be coordinating this event. Now, the core idea of this session is, first of all, in our agenda, this conference will last no more than an hour. We have invited very wonderful panel members, Hector, Sara, Lilia, and of course, Lourdes, Michelle. Thank you very much for being part. Now, I'm going to give you the general scope or agenda of today's session. Those who are following us via Zoom, we have simultaneous interpretation services. At the bottom of your screen, you can select the language of your preference. If you want to listen to a specific language, you can select English, Spanish, or Portuguese. Now, I will open the floor in general. We'll celebrate the opening ceremony, and we'll invite the panel members to explain the content of the book of this instrument. We've already also invited two experts in the field so they can express their observations and feedback regarding the book. Thank you and welcome once again. We have a direct message sent from our dear General Secretary. Please stream the video. Good morning, everyone. It's an honor for me to greet you all. Thank you for following the presentation of this wonderful instrument regarding aging, care, and Social Security. This has been developed thanks to the Center of Social Security Studies under the specific International Day of Caregiving celebrated yesterday on October 29th. First of all, I apologize for not having the opportunity to join you in this event live or in person in Mexico. We're here representing the Inter-American Conference of Social Security. We're in the summit of Social Security bodies of the Caribbean, CARICOM states, and other economies. We're here representing the Inter-American Center at Nassau, Bahamas. I thank the participation of different members of Social Security authorities, the Development Bank, and others, such as the Global Partnership for Care. And we thank the representatives of ISSSTE, the National Workers of the State of Social Security. Thank you all agencies for being at the table to analyze the results of this research efforts that were developed in the Center for Studies on Social Security. Today is a day in which we celebrate caregivers for the elderly. So I thank the experts at the panel that have accepted the invite to discuss the content of today's research and book. I thank Amelia Chico Hernandez, lead of the Center of Social Security, especially they're analyzing the health of our elders and kids. Mr. Valdivieso, he's the technical expert of the Global and Statistics Excellence Center of UN Women in Mexico. As you all well know, the Inter-American Conference on Social Security has a solid agenda and very many topics of research regarding caregiving and Social Security. With our hard work, we contribute. We want these topics to be visible. We have to think about best practices in caregiving in the Social Security bodies and authorities that are part of the membership. Today, we had the great opportunity to participate in those hearings and those public hearings that were celebrated in Costa Rica to discuss at the panel of judges or justices and triers of fact to discuss these matters about caregiving and Social Security participation. So we're going to share some information about what we celebrated that day. That day center at IMSS called CASAM. It's a center in which we provide care to the elders who have codepend with others this is part of the analysis at a regional scale, at a nation scope. So it's part of the topics that we research, as part of the agenda of all the economies involved. We have to share our best practices regarding the best paths to guarantee human rights of all our people in caregiving. It's a process. I mean, we're all aging. Our population is aging, and we're also have to study what's happening with caregivers. We're celebrating caregiving at a global scale. As I've said, it's celebrated on the 29th of October of each year. IMSS decided to summon you all to appear to analyze the content of this research regarding caregiving of the elderly and the status of our people under the protection of human rights. In the Inter-American Conference, we thank you and celebrate your efforts so we can all be working to change the paradigms and consider caregivers as part of central elements of caregiving efforts. We have to build solid grounds and bear useful knowledge that's part of the research of this, of our bodies. And I celebrate with all of you the opening of this panel. Thank you all very much for being part. We thank our General Secretary for sending that kind message. And we're going to continue with today's activities. Mr. Hector Robles is the incumbent or the lead of the body of Social Security activities. Thank you very much. Thank you all very much. Have a great day. Thank you for being part of the session in person at the beautiful conference center of the Inter-American Body. And before I continue, I'd like to salute you all on behalf of Mauricio Hernandez, the lead of sponsorships or budgeting at IMSS, but he is in a cabinet meeting with our general director, so he could not be with us on time for this opening. Now, I salute you on behalf of him, and I thank the Inter-American Conference for your great efforts. Thank you for documenting your research. It's been a great experience. It's extremely important. It's part of the core topics of research of the Mexico's IMSS, or the Mexican Social Security Body. I give you a bit of the general context or outline of what's happening in Mexico. Our demographics, our citizenship has been changing, as in Europe and in other economies. The aging process has been accelerated in different economies or in the planet. We know that we're over 140 million Mexicans in population. So by 2030, according to the National Statistics Agency in Mexico, INEGI, 12% of Mexicans, or the Mexican population, have or had turned over 60. But in our trends analysis and forecast analysis with a National Council of Studies of the Population specify that by 2030, this will double fold or multiply by 2, and our population, more than half of our population, will be over 60 years old. This is a phenomenal challenge for all Mexican homes. I mean, 67% of the households have an elder or a senior that they, or a member that they have to care for because of aging, because of other reasons such as disabilities, or because they're underage or they're infants. So at Mexican household, obviously, they're going to have to strive to find the proper mechanisms to provide giving care, specifically in the case of the elderly. So this is part of the subjects of debate in our public agenda in Mexico. There's been a lot of debate about while composing a center to take care of the elderly or the aging population. It's a priority topic, and we're still working on research and development. The obtained experience in this research is part of the instruments that Social Security authorities in this country has tried to materialize. We have to draft the institutional or internal laws of the apparatus of government for Social Security analysis to protect the elderly. We've been working in this specific topic, pension schemes, retirement funds, and we've been, unfortunately, we hadn't had a drafted general act or policies that are centered in analyzing the population in short, mid, and long term to provide some sort of benefit or economic benefit to specific vulnerable groups of the population, depending on the thresholds of age. We have compiled a lot of experience and information about the elderly. We have constituted the centers or senior centers, where they socialize, have a different type of syllabus or accreditations or activities to continue strengthening our elderly's mental health. so they continue active in a development center where they can all gather and enjoy. We immediately implemented a government program that's very successful. That's a social tourism program. We have four holiday venues in the Social Security Authority's IMSS. So we started inviting a group of elders that were supported by a group of teachers or experts so they could celebrate their holidays and go on vacation and continue building a strong health. We implemented a modest program in which we included 30 or 40 people. And right now we've increased the scope of the program to 3,000, 4,000 people who are receiving this Social Security benefits. This is a matter of discussion. So we compose this center for the seniors with the labor authorities or the ISTE authorities, and we've compiled other economies experiences, and we've witnessed and visited your centers live. We've seen what France and Korea have done. So we wanted to replicate a model to generate a center of development in which we could give some support to the elderly, so the people that compose a household can leave their elderly or their senior citizen in this day center so they can continue with their development, and they pick them up during the afternoon and take them back home. It's been a challenge, but it's part of the content of today's book. And we thank the researchers. We thank the Inter-American Conference on Social Security, because you as participating bodies are part of the apparatus that enable us to compile so much work. It's taken a lot of effort from different bodies to compile the documented information in this book. It holds great potential because with clear ideas, we will soon improve the scope of the program, this government program. We want to develop or constitute senior centers in different entities of this republic. I celebrate you all and thank you very much for your research. Thank you very much, Hector, for your kind words. Thank you for your opening announcements. Now we'll continue with a message of Sara Valdez Loza, part of the cooperation agencies of caregivers here. Thank you, Sarah, for being present. Good morning, everyone. Thank you all very much. My name is Sara Valdez. I'm the government program official in the Caregiving Alliance or Partnership. Now, first of all, I thank you all for the invite. Thank you for inviting me to this part of this panel. Thank you for having me at the Inter-American Conference on Social Security. I thank Vanessa Stoer, research lead of different topics, Lourdes Jimenez, Michelle Martinez. They're all researchers in the field of maternities, care, Social Security, and they're part of the authors of the book that we submit today, Caregiving and Social Security for the Aging. Now, this is part of what we've been discussing about the caregiving centers for the elderly to build their health. This is a major effort from IMSS. We have a case study of reference that today we're witnessing. Thank you for presenting this great book. Thanks for your research and the great effort that this executive department has materialized. Thank you for allocating budget so we can all continue learning as part of what you've compiled in this book. I thank Hector Robles, the lead of Social Security Benefit of IMSS, and I thank Emilia Chino, who is the director of this senior center. We thank the representatives of the Union of Social Security Authorities, ISTE in Mexico. I would like to enunciate some of my concerns regarding caregiving to the elderly, which are part of the debates of which are priority in the healthcare system and are part of the subjects that we analyze in all our agendas. According to World Health Organization, for the Latin American region, 17% of the population will surpass 60 years of age by 2030. And by 2050, we expect that a fourth of the population are going to be part of this demographic group. Now, in Mexico, according to the National Survey of Employment and Opportunity rolled out by INEGI in 2022, as Hector said, in 2022, our population, 14% of our population in Mexico had turned over 60. So think about 2050. 25% of the population will surpass the age of 60. So let's consider that our population, we're all aging, and our physical and mental skills or capacities change. And in some occasions, they decline. And And then there's greater risk of falling into codependence functionality. So we need greater care when we age. Simultaneously, caregiving is something that will be in great demand or in intense demand. The way in which we're caregiving and analyzing this in Social Security studies places the partner of care in the family members or relatives unequivocally. That load is taken by women. Women are seen as caregivers. So our elders, our women who are seniors, have dedicated their lifetime to caregiving in the household. And when they become seniors, they don't have retirement funds nor Social Security benefits because what caregiving, institutionally, caregiving is not paid, is unpaid work. And the apparatus of government has to guarantee the benefits and Social Security benefits for these vulnerable groups or women. So we have to implement the laws and regulations so we can caregive also for those who were caregiving in an unpaid condition, who will also need that backup. We need to respect these caregivers' autonomy, and we have to ensure that those caregivers also have a wealth-life balance. We have to analyze the best practices and think about how we redistribute caregiving activities. People who are always giving or caring for others need somehow that support and some free time. We think about how to improve the quality of our seniors, the life and quality of our seniors. We have to think about how to provide expert services which are top in quality. When we compose this senior center, we've also analyzed the immediate needs of our seniors. We have analyzed the global partnership for caregiving for the elderly, and we've included all these efforts with the member states. We have case studies of reference. We have other cases of analysis, and without doubt, what's been created here, it enables us to build that interest and build caregiving societies and listen to the voices and the needs who are providing care for others and must receive that care back. So we thank you for building this case study, and let's analyze the CASAM, the senior center, which was constituted. We have to take immediate action to tackle the situations that our demographics will have to go through, because our societies are not built on the principle of equality or fairness. So thank you all very much. Thank you very much. Thank you, dearest Sarah, for your message. Now, we'll continue with today's announcements according to the agenda. We thank the Inter-American Bank representatives who are present here at the table. As Hector Robles said, this was core for the research for this document to have been built. We have Mr. Constantini. He's the lead expert or social matter expert in social security protection from the Inter-American Bank. Thank you, sir, for joining this session and panel remotely. Marco, Sir Constantini, the floor is yours. Thank you, Vanessa, very much. And I'm here representing Pablo Ibarrarán, the Director of Social Security Activities in that department of the Inter-American Bank. Unfortunately, he could not be part of this wonderful session. I thank you very much for inviting me to be part, and I want to specifically thank the Inter-American Conference on Social Security. I thank the Mexican Institute on Social Security, IMSS, and I thank the Global Partnership or Association for Caregiving. Thank you for being part of this important initiative. Thank you all. I'd like to especially mention the Senior Center and the leads, Hernandez Avila, who's the Director of Social Security Benefits at IMSS. I thank Hector Robles. He's the Director of Social Benefits of IMSS. And I thank Ms. Emilia Chino, Director of the Senior Center. Thank you all, because from the Inter-American Development Bank, we've had the opportunity to work with you closely. I want to be very specific and mention three topics. I celebrate the fact that you've composed the senior center. That was a major program that awakens the desire of the majority of our people in our population. Our seniors should be aging gracefully in their communities and have senior centers close by to live in their natural context. And these centers will multiply the benefits in well-being, health, and balance, social activity for our seniors. So with these type of centers, we delay aging of our population by building strong networks for their development. The benefits are also material for caregivers because the senior centers enable the double activities of those relatives of the seniors in the senior centers, and their caregiving mandate is improved because we can also take care of the mental health of those who are caregiving at the household. Senior centers are strategic for governments, so we must budget them. We think about the regional context. There's more interest on developing these senior centers. So these senior centers are cost efficient. This is a solution that enables these centers to provide the right caregiving services. We don't have to go knocking door by door to provide services to the elders. And we are visible in our social security policies, provisions, and in our communities. So we can allocate a budget, human capital, which is allocated, and build strong facilities and have a visible senior center where we help the communities without having to open the doors of the household where these seniors live. The second strong point, I celebrate the engagement of the Mexican authorities, IMSS, the Mexican Social Security bodies, and thank you for enabling all this research to take place and to be so thorough. We thank the fact that your research enables us to tackle poverty, so we have technically budgeted an impact assessment of the programs. We have evaluated the processes, and a cost efficiency research has taken place. This type of research and works or books enables us to measure the results of this pilot programs and acknowledge the operational challenges. So we have to analyze the possibility of developing the pilot program and model. We feel a lot of pride and joy because of this research with IMSS and ISTE and other bodies. We can continue generating evidence and fact-finding and build strong, solid information so we can draft stronger qualitative and quantitative indexes. The third point, I celebrate the proper timing. The research and the experience that's accrued is naturally now the output that's clearly necessary for Mexico, with clearly the Mexican president, Claudia Sheinbaum, as part of her agenda, has specified that it's crucial to build a caregiving system. To build a strong system, we have to build an analysis of daycare senior centers as the IMSS Senior Center, and what you've done is of great value. The outputs of this research is key for Latin American countries. At a regional scale, many nations are trying to replicate your program. Once again, I thank you all for being present. I once again congratulate you all for making this project material, for making the project happen. Thank you very much.
Muchísimas gracias, Marco.
Thank you very much, Marco. Thank you so much for your beautiful, wonderful message. I mean, it just triggers. Now, that's the initial phase of announcements, and just to continue analyzing the content of this group, we have the participation of Ms. Brito and Balbuena, also part of the research group of the Inter-American Conference, who are the authors of the content of the book. For that, we have to be thorough and only have 20 minutes for the study. Those who follow online, we're going to appreciate the content and the valuable material that's part of this research and hard work. Thank you, please. Hello, good morning. Thank you very much. We thank all the stakeholders for having joined today's session. Today, this document is part of what we celebrate. It's already been said that yesterday on the 29th, it was the official celebration, the International Day of Caregiving and Support for the Aging. So it's the second day in which we celebrate this day globally, thanks to the General Assembly resolution of the United States. So we're positioning ourselves in a stance of acknowledgement. We have to be sensitive enough and understand that it's critical to acknowledge caregivers, caregiving to sustain our lives, to impede our deaths. I mean, caregiving is sometimes stops people from dying. It's that enormous. It's that critical. It's so that the caregiving, people who are caregivers have that responsibility. I unite myself to the day that's celebrated. So we communicate this from the facilities of the Inter-American Conference on Social Security Studies. This book has been drafted timely. We started on January. We started visiting the senior center called CASAM in Mexico. We've paid field visits, field work, working tables. We had to go out and scout. We met the team at the senior centers and those who built this government program. We thank the Inter-American Development Bank. Thank you. We acknowledge at the beginning of this project that we were studying and researching something that holds great power. It's dignifying our people to study it. This research impacts our citizenship, our population. It impacts the region. Other social security bodies needed this to happen. There's other bodies present at the panel, government officials from ISSSTE. Those of you who know what's happening in this field in Mexico and apart from in other economies know that this effort has enabled us to take this forward. There's other programs, but the daycare senior system that's been built is unique in its kind. And that's why we had in our hands this thorough research. And from the CISS, from the Inter-American Conference, we knew that we needed to have budget to research these topics and to build this instrument, this book, because it's part of the global partnership, so we can really share or disseminate the knowledge about caregiving. Now, we have a few minutes to discuss the content of the book. Along with Michelle, I'll tell you in this reportership what was part of the research of caregiving as in this conference efforts at a global and regional efforts or national efforts. We see our populations aging at Latin American level and Caribbean. So we understand with the research of the conference what caregiving demands and requires. So we had the outline, the layout, the design. We outlined the senior center. It's a center in which we can provide expert services for the elderly in our population, specifically for those seniors that have some neurocognitive wear and they depend because of their lack of functional capacities or mobility capacities. We had to study the challenges and debate what's going to happen with the future of daycare or senior center services, and which are part of the IMSS services, which could also be used by other sister or brother institutions. With this slide, I'd like to clarify the following. Caregiving is not a problem. And I mention it because sometimes we receive essays, notes, or comments and feedback about caregiving as part of the public challenges and problems. Being a caregiver is not bad. There's no negatives. It's, historically, caregiving has been like part of the burdens or tasks of women at the household, and it's invisible and it's unpaid. So people who are working on caregiving usually receive the negatives, throughout the lifetime, because women who are caregivers receive the negatives, but those, irrespective of gender, they are there to give care, then have to be studied to see how it burdens social security apparatuses. So there should be an immediate response from the apparatus of government. So there should be the right legislations and provisions that give the grounds to protect those who are in caregiving. Amidst this administration, we've seen the transitions. You see, we've been summoned to appear, to speak about caregivers. It's something that we couldn't have even thought of years ago. So IMSS, that's celebrating more than 80 years, and it's carried out its duties, and IMSS are enabling this research along with other bodies to research caregiving amidst the transition, and how these points are solid in matter of debate in the public lobby, in the public debate, and now these subjects are visible. So what happens? I mean, caregiving is a topic that should be supported and analyzed by the public apparatus of government because it's part of their mandate. So we appeal to these bodies so they can take on these new roles. Social security bodies are not neutral bodies, and proof of that is the fact that here we have been called to appear and research a program that was previously unthinkable. We have all the historic efforts as part of the analysis of caregivers. Social security bodies and their apparatus are the means to issue an immediate response to public management and public administration, and the fact that the mandate is to keep our populations historically, irrespective of transitions. The topics of research at this Inter-American Conference has this in the agenda. So the Inter-American Conference is core. We enable debate and dialogue amongst bodies of Social Security and protect access to care. So this coexists amidst a paradox because this type of books, like the books drafted by Pautasi and Flavio, these researchers were the first to investigate the paradox of caregiving and Social Security. I mean, because historically, everyone thought that somebody was going to research, but you see what it is. So right now, we're working on this research. We're technically assisting others, and we build strong networks in different partnerships or global partnerships for caregivers. We have different debates with Glaxo and other networks of scholars or the academia in LATAM. The General Secretary already said that we had the enormous opportunity to discuss this with the Inter-American Court on Human Rights. We didn't go to the court to ask them if caregivers have rights. We know the scope of caregiving and the grounds of it. And we went to the Inter-American Court and submitted our arguments about the fact that Social Security and caregiving is completely coexistent. So in this Inter-American Conference, we're the source of data, solid and objective data for caregiving studies. We're going to have the second edition or second book. And till present, we've participated in over 70 debates of caregiving forums in Mexico and in the region. So I show you the general picture, the globe's picture, the region's picture of what's happening, why we're studying this senior daycare or center. The aging population is not an adverse phenomenon. That's the first thing that we have to take out of our chip, out of our radar. Aging is not an adverse phenomenon. Aging is a challenge, yes. Fundamentally, aging populations are challenges on Social Security bodies, but they're not negative phenomenons. The fact is that the caregiving services for our elderly lead us to understand that the elderly of our populations are unsatisfied. That another point. The aging population and our seniors demand cares, and they're not receiving the services. And the national legislations for caregiving is matter of lobby, it's matter of debate. The legislators are thinking about it. They're making announcements. So law and provisions should be drafted with a spirit to give immediate answer or response mechanisms. So one of the strong pillars are Social Security services and bodies. This is the general scenario of Mexico. We've analyzed the National Caregiving System program. It's been announced publicly. We have the centers and the IMSS, amongst other institutions of Social Security services, have been mentioned as part of the Mexico's agenda. We've already mentioned what happened with the Inter-American Convention. Mexico ratified and signed the Inter-American Convention on the Rights of the Elderly back in 2023. Mexico is a member or ratified country. In that convention, we read that all the aging population should have a program or government system so they can receive the services. So it's a regional mandate. What is the Mexican nation doing to guarantee access to those rights? Mexico signed it. Mexico ratified the convention. Convention in 2023. For those that did not know, in Mexico, the rights for caregivers have now been acknowledged through a court case law ruling of the Supreme Court of Justice of this nation. In that case law, in that ruling of the Supreme Court, the acknowledgement of the triple dimension of those rights are there in the spirit of that law. Which are the services, the classical aging services that are observed and analyzed in the systems or programs of Social Security? The coverage of healthcare systems, services, medical services, and retirement pension schemes for retirement of the aging population. But now there's new. But now you've mentioned the classical needs during aging population. So we see senior clubs, daycare senior clubs, and other bodies that are probably not providing the services for neurocognitive functional development of our seniors or elders. Those other centers are there for those seniors that don't have that, like a functional or mobility need that require expert cares. So there's programs for their tourism, the aging population's tourism, as I've said, physical activities and programs. And another classical benefit is part of the housing or collective housing management, which is administrated with the government social security programs. And I found the Argentinian case of reference. What they're doing in the Argentinian government is that they're offering housing loans for the elderly of the population. So aging is something that is correlated traditionally to the services offered by the social security bodies. So they co-depend. There's interdependence or coexistence. Now, caregiving amid some context demand services that are offered in social security apparatuses or agencies. But we're not saying that caregiving is a contingency nor a risk. Care that's given to the elders is a right, like any other right, having the right to access health services, and it's managed through the social security bodies. Here in this slide, you can see how the program implemented by IMSS in the senior center leads us to make it a tangible. It's now material. A social security body such as IMSS can contribute to guarantee that our seniors have access to service and health, specifically the rights of our seniors in the population, the elders. I'm not saying that it's the sole infrastructure or facilities. I'm not just saying that social security bodies are the only path. It's an alternative for these services to be offered. It's necessarily a topic that needs to be debated. Who is liable? Who is responsible for giving these seniors the services? And that's why we materialize the senior center. It's part of the regional umbrella. We see the region's impact, the country's situations. And I want to share some numbers. Michelle and I researched and studied in the first phase of our research when kicked off. You know what triggered our alerts or red flags in the positive sense is that the senior center is now material because we needed to offer services that have some needs. There's the senior center in which we acknowledge the caregiving services which serve people who are not paid. And we want to reach the principle of equality, of equity. This is very powerful when we debate the needs, and we need to draft and legislate, and who is co-responsible for offering the services, such as in the senior centers. We see this program like innovate. IMSS thought about creating this senior center programs to improve the lives of the elderly. It was thought of so we can also reduce the load on caregiving women to fight for that gender equality. So caregiving women like have that distributed burden of caregiving. And now the floor is open for my colleague who will continue with the content of the presentation. We thank you all for being part of this session today. Thank you for appearing in this beautiful venue. And we thank you all who are following remotely the streaming via Zoom. And at the beginning of this session, at the beginning of our presentation, we didn't share this in initial statistics, but we share now this population statistics in the slides so you can really understand the context, the regional context of the population which is aging that we speak of. So with this chart, you can see Latin American, the Caribbean, and the regional aging population and in Mexico as a whole with its regional studies. Now, we mentioned that in the present, that now, according to the CONAPO, National Population Registry Agency in Mexico, measure the 12% of the population in Mexico as part of the aging elderly groups of the demographics. And we estimate or calculate that by 2050, it's going to multiply by two. So it's 22.5% by 2050. And simultaneously, we have also measured additional factors that lead us to properly characterize the aging populations or demographic. The life expectancy growth at a regional scale, and specifically in Mexico, especially for women, has been measured there in the chart. So this leads us to stress on what's happening to measure the difference between genders. And this has, and the gender differences have an impact as well. So for males, thank you. In 2022, the male life expectancy was of 76.6 years or 72.6. So those are the numbers. So we estimate that by 2050, males would reach 76.6 years of age, and women in 2050, it's 82.5 years. So women, us, will tend to live longer. And that's why we share the statistics and the population pyramid, and the numbers in 2050 are there. And as I've told you, we need to understand the dimension and the impact of the statistics, these numbers. How are we doing in population by 2050? How many years are we going to have in our lifetime? Which age or which groups of the population are we going to belong to by 2050? So in that sense, we're going to be part of those aging population. We're going to be considered seniors or elderly, and we think about the individual and social conditions of the elderly by then in that time frame. Next slide. Going to the specs, to the specific services when you need to be taken care of, we've implemented the use of a statistic tool. This tool was a rolled out survey to measure the services for the seniors with ENASIC. The rolled out survey is called ENASIC. In 2022, it happened, so we measure what happened with the population. It's 77.8% of the households would need to caregive for others. So the majority of the household of the analysis have a person that depends on others that need to be taken care of, irrespective of the vulnerable groups they belong to, seniors, disabled, vulnerable or not vulnerable, there's going to be someone in need. 35.5% of the population requires care but does not receive any care. So think about the factors and variables that we need to add up. And there, we think about the services that are offered by the healthcare apparatus or systems that can receive these groups of our population. You see the increase of demand. It's a 35.5% of requirements by the population that do not receive the services. The second, the elders or the seniors demand more caregiving services, more than our children. But in terms of coverage, only 77.6% of our seniors, they don't receive the cares that they need. So only 22.4% of our seniors receive any coverage or service, which are necessary. And here, and I want to stress on another point, caregiving services are usually offered or given by women. Women are the caregivers at the household when their families or have a disability or they take care of a senior. The daughter or granddaughter take care of others. It's like 44.3%. And only males or grandchildren or who are males offer any services. So you see, most girls or caregivers are women, and the males are only 13.8%. In the case of the study, when the elders do not have a disability or depend on others, the main person that cares for the significant other is the spouse or partner. And then we study who takes care of the seniors. It's either the granddaughter or grandchild, either male or female. For us to materialize this study or our research, we divided our research into three phases. The first phase of our study was to review everything that was documented, all the background information, the accrued information that we've obtained different sources like the Senior Center called CASAM. And this awakened more of our spirit of researchers. So we studied which were the best practices, like the Senior Center practices at IMSS. And in the second phase of our method study was paying field visits. We went to the Senior Center. We studied what happened in it, in each department, how it functioned and operated. We also had work meetings and debated to compile the data. We also went out and interviewed people that were part of all the phases of the Senior Center constitution. We analyzed the implementation, interviewed the users, how they were trained, and other stakeholders were part of the scrutiny. Here, in the daycare or senior center study, we went to the specifics for best practices. The senior centers, I mean, they're providing services for the aging population, and our seniors can age in their household. We analyze how caregiving facilities work. These senior centers are an alternative system of care for the elders. That leads us to reanalyze the daycare system acts for caregiving. So we submitted a petition with other authorities, such as the Inter-American Development Bank. So we analyze the senior centers as alternative social services. I mean, they don't only have services for the healthcare, for providing healthcare, they strengthen our societies and our communities. These senior centers offer alternatives so they can receive socio-cultural developments, also physical therapies for the elderly, fostering the autonomy of our seniors in their context. In this slide, we compiled more data to clarify our research. We analyzed these components of the senior centers. As I've already said, we have the specific groups of our demographics, which were object of the study, the caregivers and those who receive care. So we see the clear objectives. The senior centers are there composed to strengthen our societies. They're providing specific integral services for the aging population where everything will converge. So we tie down different branches. We provide services in the senior centers for the aging population. We have specific programs and day-to-day activities. We have different tiers or stratigraphy or layers in the studies of the senior center, which are based on building community. We had to tour. We paid this visit, which was very thorough, and it's also part of the content in the book. And I know those who are present in this beautiful venue have already received our document. So we studied the senior centers, and it formally started in 2019. This analysis started thanks to IMSS. And IMSS had huge senior centers that were colossal in nature. However, with the Inter-American Development Bank participation in the research, this government apparatus can clearly outline the right heading of the services offered in these centers. So in 2020, historically, we finally ratified the collaboration between authorities and continued sharing knowledge amongst social security bodies. We visited South Korea to these centers, and we also trained people who were part of the Matia Foundation so we could continue studying care systems or centers. We selected the specific profiles that were going to be part of the services offered by the senior center. In 2023, we celebrated the opening of CASAM, or the senior center, and then in 2024, we went to audit or assess the senior center, which was budgeted by two financial sources. We paid for human capital and human resources and materials resources thanks to the budget of IMSS. And the Inter-American Development Bank also cooperated to technically support all the transference of knowledge and training for the CASAM or the senior centers. Also, one of the specificities of these senior centers are based on the model that I've already mentioned to you all. Holistically analyzing this center focuses on the human. It provides health services and other services. We consider the needs, the physical health and psychological and emotional needs correlated to the elderly. I mean, those seniors visit the senior center to receive as the main character the full services and attention offered in these units. So both parties participate to build the proper attention plan that's a set of guidelines for the elderlies who demand these services from the senior center. We outline the specific dynamism of services which are flexible for its functionality. We have in the daycare system programs that are not under a standard. I mean, there are services offered commonly, but the majority of activities that are happening in the senior center are in compliance with the outlines and guidelines of the senior center. You have some images of the senior center that's located in Casam. Our CASAM is located in the north region of Mexico in the mayorship or delegation called Gustavo Amadero. As you can see, in the senior center, we wanted to build a community that's welcoming, that's warm, that's inviting. It's not just a senior center that's cold, that's away from people, that's not inviting. See, in this senior center, we want to build a strong community that makes the senior comfortable at home. Precisely, that's a part of the effort. So when you build a home, the seniors might have a lessened sense of resistance to visit the senior centers. We have another guideline for gerontology experts, which is key. They are human capitals or experts in the healthcare field that provide services to the seniors. In 2010, we composed this initial center to provide services for the elderly, thanks to this joint effort with IMSS. In 2012, CASAM had the specific training guidelines called Primary Care Training Guidelines. And in 2020, the senior center continued growing, so we developed the guideline books for the gerontological experts for the senior care. Now, this is part of what we offer in the senior center. And in 2023, we had already certified or issued licenses for 2 sets of trainees. In the syllabus, in this training programs and guidelines lead us to develop the professional skills of daycare providers or senior care service providers. So with this, we can also assess, we can evaluate the professionals who are caregiving and they are licensed for basic care services for seniors. Those who are part of the syllabus and want to receive a license or accreditation can build their skill sets and strengthen their capacities to offer services to the aging population. That's part of the subjects that we've been studying as well. Now, to reach the final comments regarding the research, you can read the book, the digital book, and the physical book. And our lessons learned was part of this learning journey at an institutional level. We went out and interviewed different people and stakeholders involved. We asked the human capital or resources how they were trained. That's part of the investigation. We learned that there's specific needs of our aging population. Our elders need services, need to be taken care of. As you can imagine, when we think about caregiving, what comes to mind is almost exclusively children's care or daycare systems for children or infants. You think about the different branches of services offered in IMSS, IFAM, and CAS. What type of services are we offering for the aging population? So this type of specific research leads us to continue debating these matters at this table. Our aging population needs to be priority when we build programs of exclusive services and benefits for them. Not only should we protect them for retirement, and the fact is that we need to provide expert services to a group of our aging population because they depend on us, functionally depend on us, cognitively depend on us. So that's why we have to outline and build programs and services for them. We have to focus on the specific services, as Michelle said. The senior center is not a hospital. It's a senior center that integrates all the needs so we can build strong communities of elders. So that's part of the core or the essence of the senior center. And that's what we learned during our research of the elderly. So we are expecting in our demographics also probably further studies. So we thought that a lot of caregivers would just simply come and knock at our doors, and that's not necessarily happening. We can't just leave our seniors in a senior center and just leave them there. That would be bad. That would be terrible. Think about our seniors apart from what happened in COVID-19. So there's so many risks that our seniors have to face. Now we have a waiting list, a roster of seniors that want to have access to the activities offered in the senior center. You see in this other slide what we speak of great relevance. We saw that there was an absence. That we don't have all the profiles of caregivers. I mean, there's many profiles of professionals in the workforce that are there to caregive, but it's not well outlined. I mean, it's not worded. I mean, in the outlines or the books or some documents or laws, we don't have the outline of what a caregiving subject is with its correlatable duties and mechanisms. I mean, you see, they could be unionized. Caregivers have a crucial role, and when they're unionized, they can consolidate the process of innovation and development so we can really consolidate a new profile of caregiver. We think about the work programs and guidelines of trainees. When we interviewed the trainees in the senior center, they have an interest on training and obtaining a license, but we have to harmonize our laws and regulations or the standards and the internal law of IMSS, for example, so we can open and constitute new senior centers. We have to think about building another insurance scheme. Is it another branch of insurance and schemes of Social Security protection? Do we have to create a specific insurance to protect and safekeep the services for the elderly? As Michelle said, we need to train the professionals and the right profiles of caregivers. Now, what is the core idea that we want you to keep in mind? We have to be very thorough and specific when constituting Social Security services like the senior center. It's the only public center where we provide services for the elderly, whether they have functional disabilities or cognitive disabilities. This senior center is centered on the elderly, on the person. In its creation, when this center was created, we thought about gender parity. We need to redistribute the gender load of caregivers as well. Just as a closing announcement, I'll tell you that we're succinctly explaining the general coexistence and knowledge that we bear about caregiving in the system of. So we firmly believe that Social Security is a safe path so we can guarantee that our seniors are receiving the proper services, but it's not the only path. It's not the only alternative. The challenge, I mean, if we want to make the senior services available at a universal scale, is something that we still have a lot of work to do on. So this is the digital document, the instrument with a quick reference code. You can click with your camera and it'll take you to the book that's been drafted via Zoom. You can click on it and you're going to have the specific access to the instrument. On our behalf, ladies and gentlemen, we yield back. That would be all from our side.
Muchísimas gracias, Lourdes.
Thank you all very much. Thank you, Lourdes. Thank you, Michelle, for your presentation. Thank you for your research, and thank you for giving us the perfect frame to understand the research efforts of the Inter-American Institute of Social Security. Now we're going to invite two keynote speakers. We're just so happy to have you at the panel. Noé Valdivieso is a subject matter expert of the Statistic Excellence Center of UN Women. Mr. Valdivieso, thank you for taking the floor. Noé will express his comments or observations. Now, the rest of the panel members who are here have already obtained a copy of the book. Thank you all very much.
¿Sí? ¿Me escucha?
Hello?
Muchas gracias. Se escucha muy bien.
Thank you very much.
Muchas gracias, Vanessa.
Thank you very much, Vanessa. Thank you, ma'am. Thank you all for enabling me to take the floor today. Good morning, everyone. Now, I would like to commence by thanking the General Secretary Álvaro Velarca, Secretary of the Inter-American Conference on Social Security Studies. Thank you for the kind invite. Thank you for inviting UN Women to speak and submit our observations and feedback regarding this research. After the celebration of the global celebration of care for the elderly and caregivers. Thank you. I salute all the team that composes CISS, the Inter-American Conference. And on behalf of UN Women, Moni Pisani, I salute you all. And also on behalf of Teresa Guerra, who is the Global Center Coordinator of Gender Statistics of UN Women. I also respectfully thank the Presidium, and I thank our collegiate body of the Global Alliance for Care. We're also working together hand in hand with different research and efforts. I thank all the attendees and those who are following the streaming remotely. I'd like to acknowledge an acknowledgement for Lourdes Jimenez Brito and Jimenez Brito Balbuena, the authors of this book. Thank you for your research, because these subjects, these topics are crucial. These topics are crucial for our global level, for our region, as you've mentioned, or as it's been said. This research impacts. We have to analyze the aging population, the impacts regarding caregiving, and the challenges of Social Security and correlation. Allow me to mentioned that this research was object of a study, the scaffolding, the theoretical accrued knowledge of it, the conceptual accrued knowledge of it in the wording, in the spirit of the body of the document systematically leads us to understand this case study. Now, this book leads us to debate and understand the challenge in this time, in this present, what our societies are going to face as challenges. We need to provide services for the elderly of our population as caregivers. We understand the research of the demographic research. So our societies are aging fast in acceleration. By 2050, the percentage of our populations who are older or seniors will be multiplied by 2. But with the trends of the demographics and aging population have measured the population by 2070, in which you have to multiply the fact that we're going to be elders times 3. In this time frame, we've studied what's happened in countries such as France. It took France 100 years to age, for their population to age, you know. Now we have to anticipate and plan in anticipation the changes in aging population and the modifications of our demographics. So we must understand and take right now the opportunities that we have to study and to somehow submit proposals and visualize what's happening with this elderly of our populations. In this book, you examine thoroughly the experiences of the Senior Center, CISS and IMSS, and you studied and researched the Senior Center. Now, this pilot program offers us lessons learned because this program impacts the nation and its object of we can replicate it, we can mirror it in other economies. It's relevant because we've built stronger elements to understand what's happening with the aging population and their social security benefits. Thank you for mentioning it so clearly in your participation. So we highlight the fact that we need to legislate with public policy, general acts, to think about how to focus this legislation at a federal scale, state level, municipal level, with these authorities to impact communities. The Inter-American Convention regarding the protection of the human rights of our elderly is what's part of the study. It's part of the book. You've already mentioned it as reference there. That's why it's so important to bring to our memories, to our minds, what Lourdes said. That convention was ratified, signed, and accepted by the Mexican government. So let's uphold that law. And we applaud you from the United Nations headquarters. So ratifying this allows us to work on harmony with other laws and legislations, with institutions, government programs, and take immediate action in advance and replicate other models that are being done in other countries of the region. The authors of the book have described when they took the floor, the strong points of the book, and I don't want to repeat the content, but I want to be very mindful about the fact that it's very important to be very democratic and spread the services. It's democratization of the services that should trigger us to move on with immediate action to fight the lack of equality and gender bias, to narrow the gaps, because the aging population, as we've measured gender-wise, I mean, women have been given care and are invisible, and we've studied this decades ago. An expert in demography, Ituirán, said that aging has the face of a woman. The aging population has the face of a woman with grievances that affect the women's lifespan from early stages of life until our women reach the last ages of their population. We speak about indigenous populations without guarantees, people that live in rural zones and marginalized zones that have access. They don't have even access to jobs or work. Systematically, we have to think about how this research really leads us to safekeeping care historically. And it's, our aging population has the face, as I've said, of our women. We are co-responsible. We're all liable. So that's why we have to develop programs to offer services and alleviate caregivers and enable us to foster the autonomy of the aging population or our seniors through these senior centers. It's important because if we take immediate action and build communities and have senior centers, we can build communities and impact future generations. When I highlight that it's important to have these the state senior centers, the municipal centers, we integrate an apparatus and integrate all layers of government, the 3 levels of government, and build stronger communities amidst immediate actions to satisfy the demographic services and needs. We think about the fecundity statistics, women giving birth, and we analyze the demographic resiliency with gender perspective amidst the analysis of the aging population. The works of today's research, this has been submitted, and in each section, in each chapter, you integrate the data of human rights, empowerment, seniority or seniors, and you prove in the content of the book how the senior center operates. Yes, so you've analyzed the senior center operations that offer services for our women and males in senior stages of life. For us, we analyze society, communities, and caregiving in your research. So we understand the great value that these research initiatives have, because these senior centers can be replicated in material in other countries. This is a cross-border study, and it it's borderless. So we have to think about how to make it all economically sustainable to guarantee that those who use the senior centers are receiving the proper services along with their relatives, so we can transform the life of our people positively. In your book, you offer a robust analysis. We can broaden the debate with this type of research. Thanks to your initiatives, we can broaden the understanding regarding caregiving. Now, 78% of the households have a specific need that is not satisfied in the study of caregiving. We studied the statistics of caregiving at the household, and we can measure the future challenges or mid and long-term challenges. Another field of research is the fact that we have to train caregivers. We don't have enough profiles of caregivers and licenses issued. That's also something that limits the offer or quality services being offered. The submitted proposal to develop training programs for the profiles is crucial. It should be catalyzed in the institutional field with the proper guidelines in different countries and region. In your book, you mentioned that it's extremely important to continue implementing a nationwide care program that is extremely relevant amidst the present, with a former change in administration, with the new agenda and announcements of the government. We have to build a strong agenda and think about the economics of it, how to distribute the federal budget, even if there's a change in administration, so we can guarantee, irrespective of administration, the social security services. With this, we share best practices. Sharing best practices leads us to cooperate and build partnerships with the UN and other bodies and authorities. So your book contributes with great value, and it leads us to progress. And think about cases of research such as Cuba, Argentina, Japan, Korea, amongst other nations, where they have developed and implemented daycare services or senior services that offer, without gender bias, an integrating list of services in an interinstitutional effort to build strong generations. So it's important to build models that we can replicate, that are sustainable throughout time, as you've submitted. And it's very important for us to mention that UN Women precisely just drafted another book about local caregiving, analyzing 11 economies of Latin America and the Caribbean. So your body and our body are under the same narrative and reportership to see and measure our progress. More accrued knowledge. What we see is that you're sharing best practices at a regional scale, and you're using new technologies and other automatization tools that have been implemented in countries such as Japan and Korea. These other economies have used automatization. So we're sharing our knowledge to see how these tools can be implemented in Latin America and Mexico. Because if we align and add these AI tools to a robust debate, we have to think about to use these technologies and think in advance to offer services to our aging populations. Let's use these opportunities. In this book, you contribute with a lot of information to comprehend what's happening with the aging population, the challenges of social security programs, and Mexico. The Senior Center in Mexico is a clear response mechanism. We implemented in the Senior Center immediate services to satisfy the needs of our aging population. However, as you've mentioned in your study, these learned experiences should be leading us to draft and legislate the specific and reach standards to be co-liable and build nationwide projects. The immediate call for our action is clear for all the stakeholders involved. From our trenches, we are calling our bodies to analyze and consolidate with brother and sister agency cooperation, stronger programs with the scholars, academia, public and private stakeholders to ensure that everyone in our societies, irrespective of their condition, irrespective of their age, we should all have access to quality services now and in the future. And it's important for me to highlight the long-term mission and vision that we have. And I quote, unquote, long-term present vision and mission. So we measured what's happening by 2050. Our population is going to be double. I'm 43, so think about my age in 2050. We have less time to live, right? Aging is part of life. It's an unavoidable process. It's a cycle. The decisions that we materialize now, today, will have a direct impact on the quality of life of future generations. So it's necessary, it's fundamental for us as bodies, as institutions, to work together tightly, to work to build strong communities under the principle of equity. Let's not leave anyone behind. Let's submit initial proposals to protect our elderly, as you've done it in the Senior Center. Thank you very much. Next slide. Okay, it's working. Thank you very much, Noé, for your observations and your feedback. Now we're going to continue with Emilia Chino Hernandez, Director of the Senior Center of Social Security. Thank you, Director, for your comments regarding the book, the study. Thank you very much. Now, good morning, everyone. I thank you all for giving me the opportunity to explain my observations about the book Aging Cares from the Senior Center for the Elderly. We thank the General Secretary of the Inter-American Conference of the Social Security, Álvaro Velarca, the executive lead by Vanessa Stoe. Thank you, ma'am, for your research, and the rest of the researchers, Stoe, Martinez, and Brito, and panel members. Thank you. The structure of the book is friendly. The characteristics which are necessary and essential to achieve its objective. It's reader-friendly. We should effectively communicate through this book. I'll comment my feedback in 3 branches. Context, the study of reference case study. 3 steps to follow. First, the general context and outline. In the book, the reportership leads us to analyze historically international policy regarding aging, the legislation. It highlights the fact that caregiving is a human right. It's not a social risk nor phenomenon. I agree with the content of the book. I applaud the clarity of the roadmap and research of the authors of the book. They highlight that the Supreme Court of Justice of this book acknowledged caregiving in its 3 dimensions: the right to be taken care of, to provide care, and self-care. Those 3 dimensions. I accentuate the 12th article of the Inter-American Charter on the chapter of seniors. I read, the elderly have a right to an integrating system of care. In that ratified convention, that is the first binding convention that acknowledges the rights of our elderly in the population. The Mexican government and state ratified that convention through a decree that was in the Gazette in 2023 in the official government Gazette. So for us to plan a program to integrate the care system apparatus, we need to know this solid data. The authors mentioned that the national survey called ENASIC led us to understand what's happening with the coverage of our elderly, 24.2%. So I submit a thorough analysis regarding the statistics, because in the statistics, we prove that 76.6% of the aging population that need care do not receive the care that they demand. 29% of the elderly have a capacity and functional capacity. So it's incorrect to think that turning 60 leads us to need care. In the field of gerontology for the elderly, we measure the functional capacity and mobility capacities and skills of the elderly to see if they need care from a third party when they take a shower, when they dress, or when they take their medications, or have a journey from their household to go grocery shopping or go to a doctor's appointment. We measure the prevalence of things about the functional codependency of our seniors. That depends and varies when we classify the capacity of the elders. If we can, as elders, go through our everyday life and don't depend or depend, you see the numbers, it's a 12%. If we consider other functional limitations of the elderly, if we need hearing aids, if we need help as a cane, or a wheelchair, then it grows to a 26%. When I share the numbers, I want to highlight that the caregiving activities are necessary to sustain life. If any person needs care and does not receive the service, they are prone to lose their life and die. So we have to be very precise when outlining the services offered or caregiving by a third party or another person. With this, we can be specific regarding the care duties and activities and acknowledge those profiles or people who are in caregiving. So that's 76.6% of the aging population that you mentioned, that they said that they didn't receive any services, even if they needed them, probably did receive the services, but they were provided by their families or relatives. Specifically, they were given care or services by the women that constitute their household. Let's remember that unfortunately, caregiving is usually a burden for women and are invisible and unpaid. The fact is that somebody receives or does not receive caregiving could lead us to the death of the elderly or the senior. If the person that's aging does not do his or her everyday tasks because they fractured a hip and nobody assists them, they will die in a few days. If the cares that are offered to the seniors are not frequent, they might survive a few months. On the other hand, if the cares that are being offered to the seniors are leading us to efficacy, the senior will live an extra 5-year term. With this, I celebrate the closure announcements regarding my observations of the book Object of Research. Flawless, immaculate work. This enables the reader to see what's been done in the Social Security apparatus. We're building a long-term strategy to legislate caregiving for the elderly that have a functional codependence. The second phase of the book, in the case study development, you briefly explain the implemented method. You sort out and organize the interviewees and the interviews you materialize. The authors of the book analyze the human capital of the senior center and analyze the operational branch and all the structure or human capital there. They submitted the results that were discussed in the Inter-American virtual or remote session with the Inter-American Bank. Now I'm enthusiastic and I feel happy because the pilot program as analyzed, it happened thanks to the efforts of different bodies and the Social Security authorities. That's IMSS is the institute that has the most scope at a national scale and a regional scale. This caregiving rights are human rights, and the Social Security authorities exist to safekeep and guarantee that the caregiving rights are protected as manifested in the Inter-American Convention. So we have to reorganize and re-understand the safe relatives and caregiving stakeholders. In the senior centers, we can observe the services that are offered to the seniors and to the caregiver. Then in the book, you outline the services listed for our seniors that are stable. They're mentioned by Dr. Robles to achieve a healthy aging. And you studied in your book the study of the seniors in the senior center. In this chapter of the book, the authors of it identified the fact that we need to technically assist ourselves to realign and rehead the program to a home environment, to an alternative. In your text, you define and outline the operational functionality of the senior center, the budgeting capacity, the allocating of it, the licensed professional caregivers that are part of the senior center. The personnel of the study and the research dates back to 2024. The lessons based on the study of the pilot program leads us to analyze the structure, the human capital structure, and how it could be the scalability of it. We need to continue training the caregivers as professionals to protect our seniors and then outline the professional, collective, or unionized efforts of caregivers. I thank the caregiver unions and the nurses who are at the table so we can build a strong program. Thanks to your availability, we have built the outline for best practices as part of the efforts and research for the Social Security authorities, a contribution for the region and the nation. In the book, you outline the fact that it's important to license the professional caregivers for our seniors. People are not born knowing how to care for others. The professionals of caregivers, our duties are complex and require training. We certified 80 professional caregivers in the senior center called CASAM. And we will issue more degrees for an extra 50 professionals, and they will be also licensed by National Autonomous University, UNAM in Mexico. We coordinated the development center creation in CASAM, and we had received over 220 students. We have internships from geriatric services, nurses, residents from family psychiatric disciplines, and others. So in our training center, we're going to have other profiles being trained in physiotherapy, psychology. And I finished my observations with 4 listed points that you'll find in the book. Number 1, human care is a human right. It should be universal. 2, replication and sustainability of senior centers with a core institutional analysis with the support of all the structures of government, the Ministry of Labor, Ministry of Transport, all the layers of government and federal authorities and bodies are in. Social Security analysis. 4, joint endeavors and efforts of research between the union and the unionized caregivers for those who are serving our seniors at a federal scale. 5, outline the professional profiles to take care of those who suffer dementia. I'd like to thank the seniors who are here. Rodolfo, thank you very much for being part of this table, who's an expert in geriatric services. I thank the Inter-American Development Bank for supporting. I thank the CASAB and Senior Centers members, the CASAB, the Social Security Unit of ONU and others, Mr. Mauricio Hernandez. I thank Social Security authorities for believing in this research. We're all working to guarantee the universal protection of human rights and caregiving. Aging is a phase that we should all celebrate. Thank you all very much. Thank you very much. I hope you can hear me. Thank you very much, Bev. Thank you so much for your kind words. Thank you for your observations, your feedback based on the document. Now is the time for a Q&A. If our attendees have questions, I mean, or our audience has questions, we received a list of 5, and I'll read them. There's more questions. There's questions for Hector and for other panel members. The first question: who are the stakeholders, or which type of physicians or expert doctors are part of the link of professionals that offer services to our seniors? What should we do to broaden the scope of this program to other levels? Third point: what do you mean by the model of centralized services for the seniors? Fourth question: how do you support or serve as an accompaniment for the seniors? Fifth question: if you want to ask questions, you can also submit them via Zoom or in person if somebody wants to take the floor and formulate a question. Of course, we're gonna... Which are the requirements to be in that wait list of the senior center?
Yo puedo contestar una, pero le pediría que la doctora Castro comentara más el enfoque de centrar a la persona que ya lo domina muy bien. ¿Sí mejor este?
No se escucha el micrófono, ¿eh?
Yo contestaría el tema de qué necesitaríamos para...
I would answer the core questions. Thank you so much. So to see how we can replicate the program or our experience, you know, we have a specific objective. We think about the resources. The resources are obtained thanks to the payments in the Social Security apparatus. We're convinced about the fact that at some point, we're going to have to work on the amendment of our legislation. And in those amendments, we have to stipulate the percentages of the payments to the Social Security bodies so we can build or sometimes budget these type of programs. In our legislation, there's loopholes or gaps regarding the pension schemes in those chapters. There's some data about daycare systems for kids or infants, but there's loopholes, or it's not outlined or drafted to serve or build the programs for the elderly. But that's something that's going to be a matter of debate. We have to think about the terms and the scope. And the efforts of the Institute lead us about what we can do in short term. In short term, what we're trying to achieve is we want to have a financial budgeting department to budget some further efforts with the program and progress with this program. And by next year, we're thinking about opening another senior center. If we can open 2 more senior centers, I mean, it's just very premature. We have to go through the process of legislation, the amendments to allocate budgeting of the federation to have clarity about the administration of the payments and the percentages of Social Security to offer these services or benefits. And that's one of my answers regarding the model. Ms. Castro, ma'am, you could probably give us further information. I know that you've been working with international cases of reference and with the Inter-American Development Bank. Maybe you have more information you contribute with. Thank you, Doctor. It's an honor for me to share this expert panel, and it's very thrilling. I want to tell you all that we're always focused on specific activities. We think about the interests of the end user of the programs. And what we try to do is we have a set of activities, and these activities or services have an impact. It's not just about having the senior take on hobbies, interests, and other activities. We want to keep our seniors' functionality and mobility for a longer time with the intervention of the apparatus of Social Security. After operating the center for many months, there's been a phase of trial and error. It's a pilot program, but we've gone through efforts based on the accrued experience. Now we have the assessment or the interviews of the experts and professionals in this subject. There's clear evidence based on the findings, based on the testimonies of the interviewed experts in that examination, cross-examination. We see that this program has been specifically successful in some fields. We're here to be accountable. We've measured the numbers, and we're ready to think about the scalability of the pilot model. There's still some room to study. We still have to study the capacity of factors such as budgeting of the centers that's been discussed this morning. We're fine-tuning the outline of the project that's centered on serving our people that could be mirrored and replicated in the future. Thank you all very much. Well, the listed questions are very interesting. I'd like to clarify that this is a model that's not, the center is not to offer medical services, but we have the expert Margarita Cruz in geriatric services. Margarita Cruz as an expert helped us out, round out and identify what's happening when in our center we receive someone with a chronic disease, and our doctor referenced the patient or the senior to another unit or hospital. We see how our Social Security bodies work with a list of experts that rotate and have different levels of expertise and follow and are working in different disciplines. In our center, we have the social elements and other activities and services being offered. We're there to socially and psychologically support the elders. We've identified that the people that suffer dementia, the relatives of these people needed more accompaniment, more support. We developed a program for the people to know about how to take care of their relatives with dementia. We have 2 groups in which we studied patients with dementia and how relatives can face and take care of their patients or relatives that are a bit more aggressive, when suffering dementia. Some of our patients with dementia seem to be homeless. And how can we acknowledge and detect a person that's suffering this? Maybe a caregiver did not decide to give that care to the relative that suffers dementia, and you have to let the caregiver know that it's okay to feel the need for further support. A family member that suffers dementia and the caregiver needs that support. We're there as a support mechanism for the caregivers. And the central services for the person, for the people, is something that we celebrate. We have, for example, on Friday, we have culinary activities. We have a program, thanks to the nutriologist of Casama, or the senior center. She drafted a program, and Friday was a special day. And together with our seniors, they built the recipe, a culinary masterpiece, and they ate it at the end. We need to know exactly what are our seniors eating, what are the traditions of our seniors, and that's how we can build a strong program that translates into solid actions. It's not like we're going to call our seniors to just draw peas or we have to ask the senior, do you like drawing, sir? Do you like to water your plants? What type of hobbies do you have? What do you like? And lastly, to belong to that wait list in our senior center, we had to identify people that meet the criteria. Those who are 60 and older, that have some mobility disabilities, if they can go to the restroom, if they need help to shower and to feed themselves, if they need like support to use specific activities such as grocery shopping, finances, and transportation. Right? That's something that we analyze patients with dementia and other patients that have other conditions or functional conditions, but they can be part of the list if they're members and affiliated to the Social Security authorities or bodies in Mexico. We can share the link or website when you can upload your petition, or you can visit in person the CASAM or the Senior Center. We will also send the link via chat box so you can also register. Thank you very much, doctors. Thank you all very much, ladies and gentlemen. I don't know if somebody here in person wants to formulate a question, would like to express comments, feedback. The floor is open.
Pues muy buenas tardes. Primero,
Well, good afternoon, everyone. First of all, thank you all for enabling us to participate today and analyze this case of reference. I'm Pamela Escobedo. I work at the CASAM, that senior center. I would like to ask you, and I'd like to know, when we were in those working tables at the workplace, it was like you just mentioned these groups of the population. In this senior center, we've analyzed and tried to outline and define what type of services are going to be offered at the senior center. We have many concepts, many ideas. This work and research leads us to plan a lot. It's been wonderful. But I'd like to ask the authors of the book, what was the most complicated methodology that you implemented to measure what's happening with the Mexican population? Because senior centers are built or composed usually for functional seniors. But I think that we still have gaps. I mean, if it's something that we're there to assist, which are the main situations that can hinder? I mean, this is a senior center for Mexico to provide services to these groups of the populations, but which were the challenges that you faced throughout the crafting of your book? Thank you for the question. We understand that there's a lot of concepts, and there's a broad spectrum. But we have to understand through consensus, we have to make our regional objectives meet, our conceptual mandates meet under this theoretical research case. In the Senior Center research case of reference, there's many components and technical components that were studied based on the specific conceptual process in which the Inter-American Development Bank worked, along with us to outline the senior centers with a broader understanding, with a broader perspective. We analyze society services in these centers, in the systems that we could create for the services for our elders. I mean, the fact is, caregiving for the elders, is something that sometimes the elders would like to take to their households, to their community. So we thought about a list of services that could coexist and co-interact. So everything does converge in this centralized material efforts. That's been our main frame or method, and I hope I clearly translated my answer. We just received another question. Okay, the first question from our attendees in person, and then we're going to answer the question we've received online. Good morning. First of all, I'd like to thank you for inviting me to such an important session after 22 months of ups and downs. I'm the geriatric practitioner or physician in the senior center. It's been ups and downs during 22 months. Thank you for inviting us. Thank you for paying those field visits. Thank you for coming to our center or CAS. That increases or makes this work and effort a bit more robust. In these type of sessions, we can discuss what's we've lived in the past 22 months. I think that's what's really important for us to understand everyone's perspective in the senior center is the human capital. Let's not forget about humane treatment to our seniors, in the senior centers. We have to, if we're caregivers, I mean, you have to be caring, you have to be loving, you have to be human. And when you offer those services, automatically you're giving your best to that senior, to that elder, to that senior that contacts your senior center, your institution. It hasn't been easy to convince the physicians involved, the doctors involved. I don't know who else at this table is a doctor. Sometimes we're not that warm. Maybe our social skills as doctors or our humane elements are not leading us to that embrace. But it's been of great satisfaction to see how the doctors in the senior center or have been trying to really manage the services in the social security apparatus. And you've mentioned the medical field as a discipline, and we thought, sometimes we think that in the senior centers, we're not a hospital. We shouldn't use medication in the senior center, but we know that having nurses in the senior center is necessary. We needed other doctors and other disciplines. We thank you, Elvira, and other professionals for analyzing that gap. I thank my colleagues from CASAM at the senior center. Our job has not been easy. It builds great satisfaction in us as professionals when we see that our elders, levels of lack of functionality grows or it's better and their cognitive functionality is better and they thank us directly or a relative comes to thank us because of the services that we're giving to their beloved relatives. So I ask you to be sensitive enough and be human enough because there's things that sound a little like sci-fi, but let's not forget about the fact that this hard work requires more time. I hope you continue this effort, and I congratulate you because in my senior years, I'm having the opportunity as a doctor to serve and support others that are aging in other levels of aging with a solid team of professionals at CASAM, starting with Dr. Chino. I thank all the members and all our human capital or the Senior Center for working together strong. Thank you all very much.
Muchísimas gracias por el comentario.
Thank you for your comments, more than questions. Thank you for your comments. And on behalf of the Inter-American Conference, I congratulate you all. I congratulate you all because you make it possible. You make this experience possible. You've built or made it tangible. The Senior Center is open with IMSS and others. I think that we've delayed or off the agenda 10 minutes, but let's take the question. We have an extra 5 minutes. Let's do this fast. I congratulate the authors of the book. I thank the team of the Senior Center and CASAM. I mean, what you've contributed with is excellent. It's been great. I want to ask you, what did you think about the ethos and pathos or the ethics at the core of the ethics in the Senior Center? How are you upholding the principles of that safe keep our elders? Thank you very much for your question. It's been a challenge, and I thank you, ma'am, very much for mentioning it now at the table because we have to write. We have to write what's possible, what's not possible. Because if we think about humanity, we're all human, right? We have an interest in the other person, the counterpart, till when? You know, I mentioned this because specifically we were in a mission of accompaniment to the person's household, because the elders come to our center at 8 a.m. and they go to their house at 3 p.m. We want them to feel that we build this community, and sometimes we want the senior to spend more time at their household. But it's like we're worried about the fact that if our seniors on their journey back home did get back home, do I call them? Am I being very intrusive? I mean, the senior staying in our center till 3, are we going to take the senior that's in our center till 5 back to their household? So it's about the informed consent. If the person's functionality and decision-making process has been object of a detriment, then it's like the elder has to sign an instrument of consent that's a binding agreement. The first level of consent and access to the senior center is to sign off that instrument, and its scalability, it's flexible. If a senior doesn't want to access the senior center, you know, it's like they don't want to be part of it because they might be object of abandonment by the relatives. They're abandoned there and they feel fear. If they just want to be with us for a few hours and their anxiety level increases, we call the relative so they can come pick them up. So it's the autonomy and informed consent of the senior that wants to get up from their home and visit the senior center, even during the weekends when the senior center is closed. The process has been very interesting. We have a lot to learn, and never keep that always on mind. And I thank you all for that question. Last question. Unfortunately, our time is a tyrant, but the floor is open for the person that's right in front of us. I want to thank you. I want to thank the Mexican Social Security apparatus and IMSS. I visit the senior center, and I'm a user of the senior center, and I was interviewed. I was lucky enough to be one of the candidates, along with my father, to visit the senior center. And I say it, as Dr. Chino and Margarita said, the way they treat us. They treat us, they're human, best practices, they follow that. They've corrected our mistakes. You know, as caregivers, sometimes we don't know, or as users and as caregivers, we don't know how to deal with certain situations. They have been taking care of us as caregivers and people who receive their care in all the levels, in all the instances. This senior center should be replicated. It should be replicated and mirrored everywhere because of the cost and benefit. So you already know that due to the statistics, by 2050, our population is going to grow. The government has to think about that in advance and think about the trends of the future. The future is now. There's some countries, based on the comments I've just heard here, there are some countries that already have like the executive of other economies have issued decrees to protect the elderly in other countries. They know that that future, that 2050 is now, is today's present, and that's why I insist. I thank IMSS and other authorities for doing what you're doing, but I want to have your commitment, your thorough engagement. Try to replicate the senior center model. Not only should we have this type of pilot in Mexico City, it should be replicated in other state entities of the country. The way you've treated us, you know, with humanity, with care, that is something that we don't feel in any other institution. We go to other institutions, we pay, we contribute, and we're mistreated. And with you, I mean, I am a believer, and as a believer, I know that God is love and we contribute. And that love that we have, mirroring God, is something that we have to give to others. We've already, as seniors, given what we've had to give as seniors. And unfortunately, in Mexico, we don't think that our seniors are valuable. But Japan, for example, treats the elderly. The elderly train their new generations. Seniors in other countries train new babies and generations because they're treating their seniors right. In these nations, the elders are disposable. We're taken as disposable people. Let's change that ship. Let's change that mindset. Our elders contribute. Our elders are worthy. think about what they've done to us and with us in the past. Thank you all very much. Thank you very much. With this, we close the participations and during the Q&A, question and answers, and the remote sessions. We have some listed questions that have been sent from remote attendees. We're going to send them to a specific panel member so they receive a response. We have a few words of closure with our doctor, the authors of the book. I want to be very specific. I want to thank some members. In the book or in the instrument, there's a quote that's burnt in my mind when we interviewed Margarita Cruz. We interviewed her, and her answer, her response is correlatable directly with what our senior just mentioned. You know, the senior just said, is this a senior center that comes from the IMSS or Mexican security authorities? And you know, from CASAM and from the senior center, we're built this center, you know, and I know that the users of the center sometimes question and doubt if it's part of the apparatus of Social Security benefits, but it is. We thank all the authorities present, all the examiners at the panel. We thank the great team of CASAM. We thank the global allies and global partnerships and bodies that are participating always in the topics of research of these inter-American Social Security bodies. Thanks, Sarah. Thank the union leaders. We thank all the panel members for giving us this time. Thank you for the government officials of ISTE, Mr. Marcos Stampini, sir. Thank you for being part as a BDI representative. We thank Vanessa Storer for being an active researcher and focusing on the topics of discussion such as caregiving and elderly. Jessica Acosta, Maquea, Oropesa, Ana Iris Yanez, all of you. I thank you all because this would not have been possible without a great structure of professionals working shoulder to shoulder to materialize these type of books. I thank Cervantes, Valeria, you made this possible. You submitted the printed version of this book. We are fighting time to draft and edit these books and have the printed copy. Ms. Garcia, Ms. Bautista, and everyone, thank you for the community team. Thank you for building this book and enabling us to share it when we celebrate the International Day for the Elderly and Caregivers. We thank Marely and all the members of the Inter-American Conference. Thank you, Yatzin Gonzalez, my great colleague and author. Michelle, it's the first time that we co-author a book for the Inter-American Conference on Social Security Studies. That's everything I have to say during this afternoon session. Thank you very much. Well, after having heard this, we celebrate the closure of the submitted edition of this book. You can receive a physical copy of this book's edition. You can get it in the Inter-American Conference. We will probably be giving away in the International Book Fair in Guadalajara. We're going to have some here in the Inter-American Conference, and there's the digital version. Thank you, allies. Thank you, Sarah. Thank you, all bodies present at this table. We thank the Inter-American Development Bank and the rest of the authorities who have been part of this analysis. Thank you. Great afternoon to you all, and I hope you continue enjoying life. Let's all enjoy our aging process. Thank you very much.